Imagine having to be amputated just because hospitals lack the capacity to perform orthopaedic surgery. Well, this is the case at the Frere Hospital in East London. According to the province's Department of Health, some patients have even faced long waiting periods of up to 10 years for this surgery. eNCA reporter Ronald Masinda is tracking the story for us, and he joins me now to give us the very latest. Ronald, as we come back to you, a very warm good morning to you once again. And I suppose going back to, relaying what patients are going through, having to wait up to even 10 years being a long time just to have surgery performed on them.
Good morning, Tumelo. Well, this is a problem across the province. In fact, at Livingston Hospital in Gqeberha, we even heard that the orthopaedic department told its patients that it cannot help them anymore as there was a shortage of surgical equipment and implants. We also heard from the MEC of Health here in the province, Nomakosazana Meth, also telling the provincial legislature that at Frere Hospital there was about 1,600 patients that needed surgery. Now, what we also know is that the department is saying that although it admits that the backlog is quite long, it is trying to work with various stakeholders to reduce this backlog so that not only lives are saved, but people health is restored. We heard from Usizwe Kupelo, who is the department's spokesperson.
The huge backlogs that we're experiencing in the province are as a result of interpersonal violence and high rate of trauma cases, especially on the roads. We are looking at addressing this by organizing weekend mass operations and also collaborating with institutions such as the Road Accident Fund. We're also looking at training more orthopedic specialists and also giving basic training to our medical officers to be able to do orthopedic operations.
All right, so we heard from the department. Let's just get a different view, and this is from someone who was a patient recently here at Cecilia Makiwane Hospital. Sabulela is telling me that he was here last month having been attacked by the community forum here in Mdantsane, and he was accused of housebreaking at the time, and as such, he was attacked so badly that both of his kneecaps were damaged. Let's get his views on what happened. Kwaqhubeka ntoni?
Into eyayisenzeka ndatyholwa kwathobana ndibone kwindlu zange nongena kule ndlu apha ko-34 xa ndibona uba lo tata ngutata ongandifuniyo forever xa ndikuloo ndlu okanye kuloo jobhu le ndlu ithetha kakubi ngam. Ya kwafika abahlali phaa ekhaya kwa-8 bantu bafuna mna emini bebaninzi bazandithatha kwakavuma utata wam uba mandithathwe for naleyithi bafika nakhona engekho nasendlini kwavulwa igeyithi ke ngoku sister wam bandithatha lo hlobo bayondibetha ke ngoku.
Okay, Sibulela, busithi uba bekhe wathathwa ixesha uba ukuyenza le operation belingakanani eli xesha binjani intlungu bukuyo?
Ixesha elithathekileyo into engange-2 weeks ndisemakhiwane mane ndijikwa e-theatre mane kuthiwa uza kwenziwa nalapha emakhiwane ke ngoku ndifakwe ibhandishi faniseke uba naxa ndihamba namadolo athi xinkxini ndiyowa mhlawumbi ndingabonwa ngumntu ndibe ndisepasejini nakhona isikhathi kodwa besininzi uba ndingekenzini ndenziwe sekukudala.
Ulindele lo 2 weeks leyo, injani imeko yakho ngoku, uziva njani? Uziva uncedakele?
Ndiziva ndincedakele and ndizibona ndingumntu obalekayo ozawukwazi ubaleka ehambeni kwesikhathi ngoba nalapha leyithi ndingumntu oqiqanjelwayo nakusasa ndingumntu oqiqanjelwayo funeka ndivukile uba ndithathe iwokhi for isikhathi nje noba yi-awari ndithathe iwokhi and then ke ngoku ndiphinde ndiyolala.
Busithi emva kwe-operation buxelele uba ungagoduka, buziva usemandleni elaa xesha okanye bucingela mhlawumbi uba oogqirha nje bebexelela le nto bebefuna ispace ngoba nezinye iimeko ziba khona mhlawumbi ibhedi zigcwale?
Uthetha eyona nto bhuti bendizayithetha uba ibizibhedi izinto bebezithethela ibhedi asina space zalazala yiloo nto ayikho enye ngaphandle kwaleyo.
All right, Sabulele. Sabulele just saying that to me that last month he was in hospital admitted after that attack. He says he was wrongfully accused by the community forum here in Mdantsane. He says that he spent at least a month in hospital, but it was only 2 weeks later that he was operated on. He said he was in extreme pain and that since being discharged, he's still in pain, and he felt that he was discharged too soon following the procedure. He says that one of the excuses that he heard from staff here at Cecilia Makiwane Hospital is the lack of beds, and that is why he was discharged so soon. He's not happy with the procedure, and he fears that he might not walk properly again.
And those are the concerns coming out, right? And also, infections that might occur within the leg, if especially he's still feeling that something might still be wrong. And this, of course, needing to be taken up with the Department of Health. Ronald, we'll leave it there for now, but further highlighting some of course, what we're seeing in many hospitals out in East London, in the Eastern Cape as a province, actually, according to Ronald Masinda, saying that orthopaedic surgeries haven't been performed, at least some of them in years. But as we've heard from one of our guests as well, those who have been had their procedures not satisfied with the outcome and the results, speaking to the capacity of some of our hospitals out in the East London. Colleague, thank you so much for this story.